Hello everyone, it is Integrated Child Care. Today let us learn how to take the history of Pallor, which is a clinical sign of anemia. Anemia is a condition in which the hemoglobin and or hematocrit concentration is 2 standard deviation lower than the normal for that age and sex. This is the normal range value of hemoglobin, hematocrit and MCV at different age group. But in general we take these values to label the anemia. In neonate, if hemoglobin is less than 14 gram per deciliter at 1 to 12 month, less than 10 gram per deciliter at 1 to 12 year, less than 11 gram per deciliter. In HOPI of Pallor, this scheme will cover all the diseases in which a child present with Pallor. First of all, ask about the duration, then onset, site and progression. Then ask about if sign and symptoms due to anemia are present. Then take history of blood loss from any site of the body. Then dig out the diseases with impaired RBC formation. Also take history of disease with increased destruction of RBCs. Those are basically hemolytic anemias of different types. Following the mnemonic dose para, first of all you have to ask about the duration, then onset, either it is sudden or gradual. If it is sudden, then think about the hemolytic anemia or blood loss, and if it is gradual, then iron deficiency anemia. Then ask about the site, where to look for Pallor, lower palpebral conjunctiva, lips, tip and dorsum of the tongue, nail beds, palmar or plantar crease, general body skin. Then inquire about the progression. Always ask about the sign or symptoms due to the anemia itself: easy fatigability, shortness of breath on exertion, anorexia, headache, lack of concentration. It will give clue to the clinical grades of the anemia or severity of the disease. Take the history of blood loss from any site. First of all, bleeding from skin. Ask about the petechiae or bruise to rule out the thrombocytopenia. Then ask about the bleeding into joint or muscles, joint swelling to rule out the hemophilia. Then is the turn of mucosal bleed. Ask about the epistaxis, hematomesis, hemoptysis, bleeding from gum, hematuria or melena to rule out the bleeding disorders. Diseases with impaired RBC formation are further divided into two categories. Number 1, deficiency of the substance essential for RBCs. For example, iron deficiency, vitamin B12 deficiency and folic acid deficiency. For iron deficiency, you have to ask about the history of pica intake, and for vitamin B12 or folic acid deficiency, ask about the soreness of tongue, numbness, loss of sensations. Then second category is not due to the deficiency of the substance which is essential for RBC's formation. In this category, there is renal failure, collagen vascular disease and bone marrow infiltration. For renal disease, you have to ask about the polyuria and take the history of dialysis. For collagen vascular disease, ask about the fever, joint pain, alopecia, and for bone marrow infiltration, in which leukemia or lymphoma and aplastic anemia come. For leukemia and lymphoma, ask about the fever, lymphadenopathy, hepatosplenomegaly or bone pains. For aplastic anemia, ask about any history of radiation or drug intake. In the last, you have to ask about the diseases with increased destruction of the RBCs or hemolytic anemias. Increased destruction of RBCs can be extrinsic or intrinsic. In extrinsic, here comes the autoimmune hemolytic anemias, drugs, infections or blood transfusion reaction. In intrinsic causes, there come the thalassemia, sickle cell disease, G6PD deficiency and hereditary spherocytosis. After every 2 seconds, someone needs blood. Donate the blood and save lives.